Hi, my name's Alice. I'm a psychologist, and I'm going to talk to you super briefly about some of the developmental concerns that I'm really interested in. My background is in neurodevelopmental conditions, and I work primarily with children who have difficulties with kind of social and academic aspects of development. So I'm going to cover three things with you in a very short space of time. I'm going to talk, first of all, about neuropsych development as it relates to attention and memory. I'm going to talk about motor and coordination difficulties, and I think I'm going to talk about language, but I can't remember. So we'll see when we get there. All right, so in relation to CHI, if we're thinking about attention and memory difficulties, both of these might be directly related to physiology, but both things might also be a more ongoing feature. So I'm well aware that some children who have a diagnosis of CHI also receive a diagnosis of something like ADHD or have ADHD type symptoms that are worth exploring. Now, for some children, that means that they will benefit from help in the classroom. So some scaffolding, particularly around things like working memory. And working memory is really interesting because there is such a broad range of what's typical in relation to working memory. So in a single year 4 classroom, you will have some children whose working memory capacity is at the range of kind of a year 6 child, and some who have the working memory capacity of a year 1 child, and all of that is typical. There's nothing there that's atypical. So teachers should be pretty good at being able to scaffold working memory for their students. Where students need a bit more help and support with this, then we can think about ways in order to support that. What might be useful is to speak to an educational psychology service via the school, if this you think is a useful thing to do. It might also be worth talking to your paediatrician to signpost towards assessment. What I'm saying here is that although these might be part and parcel of CHI, they're not things that you necessarily need to just kind of accept as part and parcel. There are things which can be scaffolded, which can be supported in the classroom, and which children can also be taught for themselves to be able to manage as they get older. You heard this morning really nicely about motor and coordination development. The areas that I'm particularly interested in are visual memory and fine motor skills. So there's some research which suggests that children who have a diagnosis of CHI may also have difficulties in these areas, and what they really mean. So when we talk about things like visual learning difficulties, what we're thinking about in reality is things like memorizing designs. So having an idea, if seeing a design and then being able to copy it somewhere else. This has got implications for copying things from the board. It's also got implications, things like understanding directions, right? Getting lost frequently. It's also going to show in relation to difficulties with mathematics. So when you get to the point where you're doing sort of, column multiplication or something, keeping in your columns is going to be a bit more tricky if you've got difficulties in these fine motor regions. So understanding where those difficulties map onto real life issues in the classroom is again going to be a useful thing in being able to advocate for your child in terms of where those difficulties are, but also in being able to support them. We might also see difficulties related to visual motor precision, which are things about handwriting or scissor use or tying your shoelaces, and they might look completely different across different children. And what is kind of worth following up really depends on how much of a problem it is in your particular space. The other thing that I wanted to talk about briefly was sensory processing. I'm not going to talk about language, but I will do later if you want to talk about it then. Sensory processing is something I am almost entirely obsessed with at the minute. About 15 to 20% of us in general have sensory processing issues. So we find either something a bit overwhelming or we're a bit understimulated and we sensory seek in order to kind of arouse ourselves. Often these can be a real cause of stress, but also they can be a result of stress. So we can see often sensory kind of sensation seeking as a response to a world which feels a little bit chaotic. If we feel a bit overwhelmed, then doing particular physical movements or kind of insisting on things being quite small and quite rigid is a really useful way of managing that overwhelm. Now, for some children, there might be an overlap between sensory processing and feeding issues, but also sensory processing issues really interfere with learning in the classroom, interfere with a child's ability to be efficient in that learning. If you're busy trying to integrate information from all different spaces and you're not doing it particularly well, then the world is more stressful for you. You're making more effort in order to be able to do something which everybody else is doing. And this is an area that right now I'm really interested in finding out a little bit more about. So if any of you would like to share those experiences, I'd be super happy to hear about them. But I'm going to pass on well, thank you.
My name is Giri Santanam. I'm a community pediatrician based in London, and I work within the child development team where we see children with neurodevelopmental problems, assess them, including autism and or suspected autism and delayed milestones and learning difficulties. And primarily my role is to look at if there is any medical reason behind that, their difficulties, and then signpost them or refer them to the appropriate services and keep a tab on them, keep a follow-up on them until they reach a point where they don't need our help. So that is the sort of overview of our work. In terms of this particular talk, I want to focus on some red flags that we can pick up in the child development. Previously, one of the speakers addressed that. And then where can we get help and support if as a parent you identify your child, or if a child known to you is having a bit of a delay, where would you go for support? And my colleague Kat will talk about the health visiting role of health visitors, which they have a crucial role to play for children under the age of 5. So with that introduction, so I think the key thing is the prompt treatment of neonatal hypoglycemia. That is the killer, and that is the problem for children within their. If that is addressed properly, majority of the long-term outcome could be resolved, and that could be difficult. It may not be straightforward, as we all know. So things have been reported that children can present with delayed development, particularly speech and language delay, and they may also develop learning problems, memory problems, and even ADHD has been reported in literature. And the Scandinavian study showed that they may have problems with visual and sensory motor functions, essentially all leading to some form of learning difficulties. And this I picked up from the is this called a global report, global registry, annual report. And there they mentioned from the neurological point of view, they have epilepsy, which is dealt by the neurologist, but learning disability is also high in the frequency, and we can see some autism as well. So neurodevelopmental problems are relevant in this case, and talking and speech and language comes there as a top in terms of developmental delay. And they may present early with delayed milestones, or sometimes they may be only picked up when they actually are struggling to cope in the school. Principles of child development, I'm going to skip that. We know about the domains. The gross motor deals with the big muscle action, fine motor and adaptive or the dexterity of the hands. Speech and language, and it goes often with vision. So any child who is having problem with fine motor skills or adaptive skills, it's always better to check the vision. So if they are clumsy, if they bump into objects, it's always best to check their vision, make sure that they can. And likewise, if any child is suffering from or having a bit of a speech and language problem, it's 100% mandatory to check their hearing. And personal social, this relates to how they form relationships. And cognitive development is how they learn, think, play, and solve problems. So some of the gross motor red flags I would like to bring up is to typically they would say not walking by 18 months is considered as a, a red flag for many children. But even before, some children will have some symptoms, even when they are infants. They may be a bit floppy or stiff, or even when they start to walk, and they may have problems with difficulty in balancing and frequent falling. And physiotherapists will help in identifying and managing this. When it comes to fine motor and vision, as I said, it's linked with vision. So they may have some problems when reaching for objects and rubbing their eyes. The eyes may be crossed in or crossed out, etc. And then hand preference, if they develop before 1 year of age, normally children are ambidextrous. They use both hands until about 1.5, 2. If they develop an early hand preference, then we need to look into that. And they may struggle with the self-help skills. And when they start to go to school, this is when we get a lot of referrals about that. Their handwriting is poor and they can't handle, and they come back and we assess them. Occupational therapists are the ones. Speech and language therapists, the red flags are not really clear. But when I speak to the speech and language therapist in our team, they say normally we can wait until 2 before the child has any consistent words. That's a sort of ballpark figure, if you like. And is there how is this speech progressing from there is the most important thing. Is it progressing, is it stagnating, or is it regressing with that language development? Or if they are having problems in speech articulation and speech production. So personal, social, again, a lot of interest in this. We are seeing a lot of autism referrals coming up from even as an infant health visitor does the 2-year review or even 1-year review, and they start referring to us, saying that the child is not showing the appropriate social response. So a lot of awareness is there. And so whether they are showing the nonverbal communications like finger pointing, gestures, etc., social response, and shared enjoyment with parents and givers, etc. Some of these are just the questionnaires I would like to put on for autism and ADHD, which we commonly use is the MCHAT. So that's used between 16 and 30 months of age. Often the health visitors, when they go and do a 1.5, 2-year developmental review, and if they see a child who has communication problems, and if they are suspecting autism, they tend to do the MCHAT. It stands for Modified Checklist. And if the score comes high, they will then refer that child with the suspicion of autism to our services. And then we also use the social communication questionnaire. This can be, I think, downloaded, and as a parent, you can fill in if you are concerned. And for ADHD, there are a couple of questionnaires, which is commonly used is SNAP-4, and SDQ is the one for behavioral screening. Some definition, there's always confusion about this developmental delay, global developmental delay, and things like that. We use this term learning difficulties for children who are above the age of 5, who basically struggle in the school. And there is an official definition called learning disability, and that needs to be assessed often by a psychologist, education psychologist, where they do some IQ testing using those official tests, and then give the diagnosis of learning disability. But for most of the clinical purposes, we use the term learning difficulties if they struggle in school. And that could be a form of memory, retention, attention, concentration. It could be anything. But they all form under the umbrella of learning difficulties. So I want to concentrate on health and support. For children under 5, I think the primary person to go to is the GP or the health visitor. And the other place is local offer. I'll tell you what it is. If the child is not in a school or a nursery, and then children's centers, they also offer a range of services, including family support, health information, etc., for children under 5. And if they don't know whom to refer, they could also signpost. And they could refer the children to the community pediatric services if they have any concerns about a child. For children over 5, in the school age, I think the best point of contact is a SENCO, who is the Special Education Needs Coordinator. Every school will have a SENCO, and send information, which stands for Special Education Needs and Disability Information, Advice and Support Services. They're being opened up in many areas, I think across the country. And the local offer, which looks like, sorry, I'll come there. This was, I've taken that from Tower Hamlets, from where I work. So you can see that it says SEND, and if you click on that, it takes you to a lot of options. And I did have a look at somewhere local. This is the nearest I could get, Leicester, and they got the central local offer. So local offer is nothing but like a service directory about where to go for what particular things. And that is a very, very resourceful place for early help. For adults, I just thought I'll add 2 lines on that. And with the SEN support, additional support, the child may just require a single therapy, like a speech and language therapy, and things may improve. Or if it is a complex need, it may need education, health, and care plan. So education is provided by the school, health is by the health people, and care is by the social care. And social care services, this morning somebody talked about respite care. So they deal with that. Continuing care package, sometimes the social workers do that assessment, and in other places the children's community nurses do. They do the continuing care assessment package and decide. Finally, so this question was put to me, whether all these children need a neurodevelopmental, children with HI and neurocognitive assessment. And I thought I will look into what is the available research for it. And when I bumped into this, CHOP stands for Children's Hospital of Philadelphia. In USA, they recommend all children should have, it's essential. And they have a different model to us, so we can't extrapolate that. This Finnish study, which was done recently, which found that children who have been treated recently actually are doing very well. They have normal neurodevelopment and mild developmental difficulties compared to children treated earlier. But when I looked at the GOSH leaflet, they haven't mentioned anything about all children having neurodevelopmental follow-up. They haven't stressed on that. They said some children may have problems and they may need additional support. They left an open statement there. And Manchester also seemed to support that. So unless standard batteries are used, and then such children may also need additional support. So none of them tell that these children needs to be followed up, all of them. And I think that needs a debate, that needs to be, yeah. And I think perhaps it's probably fair for me to say that if they have developmental concerns, definitely there is a role for a community pediatric services to be involved, and they should be involved early. I just want to touch base on the community pediatric services. Most community services will accept children with 2 or more developmental delay and with an impact on neurodevelopment. Perhaps with that, we can say that HI definitely has an impact on that, and we need to get that into the system. ADHD assessment is offered by pediatrician, and in many areas around London, it's done by the camps. And who can refer to us? Parents cannot refer to us. That is the main thing. They can't do a direct referral. But parents can sometimes refer to the individual services, like speech and language, occupational therapy, or physiotherapy, and depending on the local commissioning. So services. And I put some useful websites here which can be used. Yeah, okay. Thank you very much.
So, confusing system, isn't it? So I'm here, I'm Kat Sturgeon. I'm a paediatric nurse by background, a children's nurse by background, a health visitor, and I'm the head of the 0 to 19 service in the area that Dr. Geary works in Tower Hamlets in North East London. And I want to talk to you about what health visitors actually do. I think most people heard the term health visitor, but often I get help. We don't really know what it is you do other than weighing babies. So there's a little bit more to it, and it is confusing. So I hope I can bring some clarity. So health visitors are all registered nurses or midwives by background. We come from a variety of backgrounds, nursing backgrounds. It could be children's nurses like myself, adult nurses, mental health nurses, and as I said, midwives. So we're experts in some fields, but actually we have a range of expertise within our service, which is great because we can draw on each other if we need to and support the families that are in our community. We're a universal service. That means everybody in the UK with a child under 5 has access to a health visitor automatically. Nobody needs to be referred. You should see a health visitor when your baby is first born, or you should have seen a health visitor. Lots of children here and very young ones. Or if you move to the area, or if you move from abroad, you should have access to a health visitor. And then there are certain touch points when we will get in touch, or we should get in touch. Okay, so we don't need a referral. We provide information and health promoting activities. We support growth and development of children to ensure that children can grow up healthy and meet their full potential, and to identify if there are any concerns, that we identify that early. But we also support families. We look at family as a whole. We call it a holistic assessment because we know that children need to grow up in a family that is well and healthy. So we also look at the needs of siblings and of parents. So we give emotional support as well as practical support. And we can support with a range of things, potty training, or your children at some point will going to be learn how to use the toilet. If there's any problems, speak to your health visitor or your health visiting team. We are a skill mixed team. In most areas have a skill mixed team. There might be nursery nurses working in there or community staff nurses. So speak to your health visiting service if you need any practical support with feeding. Although most children probably have a feeding plan in place, obviously always go by what the specialist dietitian tells you to do, but share that with your health visitors so they're aware that they don't give any conflicting information. Really important, so always keep the health visitor informed. We carry out development checks, so we touched on to that, and that really depends on what kind of area you live in the UK. So in England, that's one of my next slides, we do 5 developmental checks, actually just changed the Healthy Child Programme, we call it the National Healthy Child Programme, changed it to 7 checks, but most areas do the 5. They do more in Scotland, some in, also in Wales and in Northern Ireland. So there is slight differences to the services. I'll go into that a bit more. Yes, so in England we have the 5. In Scotland there's 11 home visits. That's what the programme says. And we have Wales should have 7 checks. And in Northern Ireland, I was told, focuses mainly on the first year because of the capacity within the service. So even though probably if in the different areas you might experience different service offers within your local area, and that depends on what's commissioned locally in your local authority, in your integrated care board, but also what the capacity is within the team. So like most services in the NHS, health visiting services can be stretched. So sometimes they focus on maybe the first year of life or children with additional needs. So, but to always reach out to your health visitor if you don't hear from them. Try and reach out to them if you need anything for yourself or for your child, if you're worried about anything like that. We can provide early intervention when we do a development check. The area where we live, we do a new birth visit between the first 2 weeks, then a check at 3 to 4 months, 6 to 8 weeks, 3 to 4 months at age 1 and age 2. So just to identify any emerging issues very early, so we might be able to give you some advice how to promote development. Might signpost you to a children's centre. There's lots of activities. They're all free and they're great for encouraging good development. Or we can instigate a referral to a specialist service, to a speech and language service, or to the community paediatrician. Most services have long waiting lists, so if we find things early, let's refer children early so they get into the system and get seen, whilst we provide you with additional advice and support how to support your child at home and what activities you can do. We do get involved with the multidisciplinary team, so in our world, it looks like all kind of professionals that are involved in the child's care. We call the MDT, slightly different to the DST process, which Kara talked about. We work with GPs and the specialist services. Often it's virtually by just sharing some information, but we can get involved. But we don't always know if children have a diagnosis or who they're seeing, because it's not very consistent, the information sharing. So do tell your health visitor who's involved in your care, and if you need to kind of join up and meet. We can refer you to early help services, like Dr. Giri touched on. So early help can happen in children's and family centres, family support, and they might arrange some meetings if there are complex issues within a family, because they might you have a child with medical needs, and that has an impact, like colleagues from Great Ormond Street said earlier. So the impact can be financially, it could be emotional support at home. So if there's lots of different things, we might call a meeting with you, a team around the child, a team around the family meeting, where all professionals can sit together with you to make a plan to who's best or how best to support your family, so your children can grow and develop healthy and everybody is looked after in the family. In terms of milestones, so as I said, we check development at set kind of key periods. But if you have a concern at any time and you don't have an appointment with your medical team where you can raise it, reach out. We can do development checks at any age. If you're not sure, call us, call your team, and they might give you some advice over the phone, or reassurance might invite you to a clinic or come and see you at home. So ask for that support. Okay. Look in your Red Book. Red Book is a good resource. There's little checklists in there, especially for the early years. Can my baby see? Can my baby hear? And other things, and lots of different information to different agencies, contact the families in there, and other useful information. So have a look if you have it at home. Often when a baby is first born, you get overloaded with information, you might forget about what we've been given. So take it back out, have a look and see if there's anything useful. It's got the developmental milestones in there, which is quite useful. There's a digital version of the Red Book available at the moment. It's only available in North East London, but they're working, NHS Digital is working on a digital solution to that as well. The Ages and Stages Questionnaire is a developmental tool that we use in health visiting. It's quite a basic assessment tool that we encourage parents to do at home with their child, and then bring into the checks at age 1 and age 2. And if there are any kind of concerns, when development happens, as we've said earlier, it's not linear, it can happen at very different stages. Some things children excel in, others they need a little bit of support in. But if you identify any potential areas that are concerning, we can then initiate those referrals very early. So the Ages and Stages Questionnaire, you probably hear about that when you see your health visitor. There are lots of online resources. If you're not quite sure and think, oh, is there a problem, is there not? Obviously speak to us if you don't, if you worry at home. Look at evidence-based websites, so websites that are trusted, have trusted professional advice. NHS Start for Life is a good one. The Institute of Health Visiting, that's a really good website. They have actually produced a parent tip on hypoglycemia, looking at the signs and symptoms. So that's on there, and I think it's linked on the charity's website. So another good resource. And then in terms of speech and language, Talking Point is a good website. It's got a little checklist on there and lots of advice to encourage speech and language communication development. UNICEF has a child developmental milestones section on there, and lots of the local organisations and NHS trusts have good websites. I looked at the Greater Glasgow and Clyde website, and that's got another developmental milestone. So check in your local area, Google, and you probably find something. Make sure it's evidence-based. And that's the leaflet I told you about. So if you're not sure how to contact your health visitor, if you lost the information, I would say look in your Red Book. Might be on the first page. When you first see health visitor, put either a sticker or a leaflet into your Red Book. Speak to your GP. You might call the receptionist there. Might be able to put you in touch. If you don't know how to contact them, use Google. Most health visiting services have websites, so you might be able to find them there, or the local offer, or speak to your medical team at the local hospital. They often have the details for the health visitor as well. Okay. I popped some reference on here for the different websites that I mentioned, the IHV and Start for Life and all of that. So hopefully that is shared with you. Thank you very much.